for me, it's so important to do this talk because number one, October is Breast Cancer Awareness Month. And number two, I believe that 50% of the cancer cases I'm seeing these days is breast cancer. So there's so much that we can do to prevent and reverse this disease. And prevention, of course, is more important than cure, but cure is, of course, important if we've already got it. So let's get into this talk right away. So just a word about SHARAN. SHARAN stands for Sanctuary for Health and Reconnection to Animals and Nature. And why reconnection to animals and nature? Because animals in nature know how to be well, and animals in nature get much less disease than we do. Why are we getting so many diseases? And so I want to say that I learned almost everything I know from nature. A lot of the things that I'll be talking to you about today will be different from what you may have heard from doctors in conventional medicine. So it's important to see everything and then decide how you want to live your life in order to prevent and reverse diseases. Today's topic, breast cancer prevention and cure. And I already told you it's because October is Breast Cancer Awareness Month. And I want to start the very first, before we even begin, with a video of someone who came to us as SHARAN many years ago. This is Nisha Koiri. She was told by her doctors that she had less than 45 days to live if she didn't follow conventional treatment. She never went back to those doctors again. She changed her life, and now, after so many years, she's leading people not just to prevent and reverse cancer, but to avoid vaccinations. She's amongst the biggest groups in India, especially after COVID vaccine, which did so much damage. And one of the damages that COVID vaccine did was also make cancers and breast cancer much more quick growing. So let's hear from her.
I was advised immediate surgery, full mastectomy therapy, and radiation. But on researching, I came to know that chemotherapy is highly, highly toxic for the body. In fact, it causes cancer because it cannot kill the cancer stem cells and it does cause cancer. Radiation is again very, very bad. So I was looking for a solution which will let food be my medicine. And thank God in the very same month of May, I could find SHARAN. And through SHARAN's diet, I'm also doing naturopathy and homeopathy, but that came much later. Naturopathy was at the beginning. But my main is the food is my medicine, and I'm following it very, very nicely, very strictly, and very lovingly actually, enjoying every day, every meal, loving my life. And thank God I have not visited any oncologist. Wow. And lumps in the breast have now reduced by half. I'm working, wow. I go to the gym. Tell people that I was diagnosed with cancer. Nobody believes it because looking at me, of course, nobody can come to know. I was given only 45 days to live. So this was a year back, and it's in May, that is. More than a year now, and I'm happily living my life. It spread second life. No, they said that's the cancer, you get a death sentence. Basically, with all cancer doctors, they'll give you a death sentence. If you don't do the surgery, I said, do I have 6 months? They said, no, 3 months.
Imagine that. She had the courage to take charge of her life. Now, that was in May 2016. In May 2018, she wrote to me and she said, I just realized today was the day 2 years back that I was diagnosed and given only 45 days to live, if not doing any kind of surgery, chemo, and radiation. But 2 years are up. Thank you so much for starting SHARAN, which beautifully teaches how to have food as medicine. We'll go on. Another email 1 year later. Happy to share with you that with God's blessings, the latest ultrasound shows absolutely no metastasis, shows calcification process in the lumps, and I want to thank you, and so on. Now remember, now it's 2004, 2024, and she is still doing well, working harder than ever before, and just to let people know that this can be treated and healed. Isn't that amazing? Now, Dr. Lorraine Day, who I don't want you to miss because this is also a orthopedic surgeon who suffered from breast cancer. And the link that I put here for this particular YouTube is one of her best short videos where she talks about why she did not go for surgery. Because being a doctor, all her doctor friends told her that she should go in for conventional treatment. And she said no, because she said, the cause of my cancer is not that I have too many breasts. So why should I cut out my breasts? And this is so important. Her whole thought process as a conventional medical doctor is so important to understand, because today the first thing that is done is a biopsy. When there's an injury to the tumor, we have to understand that the tumor is the way the body segregates toxic material. For example, when we have a boil, what the body is trying to do is accumulate all the infectious material in one part. Here, also in breast cancer, the body is trying to accumulate the problem in one part. But when we injure, there's a chance for it to spread. When we do surgery, there's a chance for it to spread. So that doesn't mean that these procedures are not important, but we need to think about it, right? And so she said that I want to find out what are the causes of my cancer and remove them so that I heal. And the process of healing for her led from the cancer going from the size of a marble to the size of a grapefruit. And there was a time when she felt that she may not survive the night. But she had faith that she's doing the right thing. And this video is really worth a watch, because we need to look at everything before we make a decision. And all too often, patients go to the doctor and doctors prepare them for treatment within the next few days. And patients don't wait or think because they're frightened. Maybe Nisha Koiri was lucky that she was frightened of going straight for treatment, but also her mind was set on getting well through natural means. And I want to say that the body always works to heal if we're willing to put in the right efforts. So now let's just talk about what is cancer from the scientific, common medical point of view, and of course, even our point of view. What is cancer is science. So cancer is a loss of normal growth control. Normally, our cells multiply and then the extra cells die. The old cells die, the new cells replace them. But in cancer, the growth is exponential and it just doesn't stop. Now, what are the signs and symptoms of breast cancer? You could come to know that you have breast cancer or someone has breast cancer because of a lump or a thickened area of the skin, or the nipple looks flattened or turned inwards, changes in the color of the breast, it could turn darker or reddish, change in the shape, size, appearance of a breast. Remember that it doesn't happen usually in two, only in one. So a difference in the appearance of one breast Or the skin over a breast, it looks dimpled or like an orange peel, or peeling, scaling, flaking of the skin on the breast, pain in the breast or axilla. And there are two main types of cancer. The first is invasive ductal carcinoma, where the uh, the cells in the duct from the nipple, the milk ducts, are the ones which start multiplying. And the other is the lobular car carcinoma, where the cancer cells start in the lobules, the milk secreting glands of the breast. And then there are other kinds also, but these are less common. Now, what are the risk factors? Who's likely to get breast cancer? And remember, we are going to talk about this from our holistic point of view. This is just from the normal medical point of view, that it's more common in women. That does not mean that breast cancer doesn't happen in men. And today, so many men have gynecomastia, breasts that look like women's breasts. So this can happen in both men and women. You don't have to have gynecomastia to get breast cancer, because everyone has breasts. Women's breasts look different, that's all. And then age. The older, the more the risk of breast cancer. Family history, it's known that certain DNA changes, one is BRCA1 and BRCA2, these are the most common, can increase your risk of breast cancer. That does not mean that if you have this DNA change, you will get breast cancer, not at all. And yet, there are people who have removed their breasts. Angelina Jolie is one of the most well known celebrities who has done that because of this gene. And then past history, like if you've had breast cancer once and if it has been treated, the chances of getting it again are pretty high, especially if you have not removed the causes of breast cancer. Early menarche. Today, so many girls are reaching puberty early, and this predisposes to breast cancer, which is why we're seeing breast cancers also at an earlier age, and all cancers at an earlier age. Late menopause after 55. Alcohol is a big risk factor. It's surprising what a big risk factor alcohol is. Late pregnancy or no pregnancy is a risk factor. Hormonal therapy, which means oral contraceptives, or hormone replacement therapy after pregnancy or after hysterectomy. Obesity. Obesity is a comorbidity for so many diseases. Tight clothing, because it causes lack of circulation, like tight bra or tight, clothes being extra tight. And the standard advice to reduce the chances of cancer are self-examination, mammography, minimize alcohol, that's an important one, exercise, important too, and weight control, important too. Personally, I don't go for mammography regularly. And the main reason is that when we go in for mammography, there's a lot of pressure put on the breast. And that, anyway, pressure is one of the causes of breast cancer. The other is that, once you have small things detected, you look for it more. It's like you're always looking for it and conscious of it. But and sometimes, if something is suspected, biopsies are done and so on. I would prefer, if we are always conscious that this can happen to anyone, it's happening to so many people, let's do everything to prevent it. And if we notice any symptoms that are, that give us the idea that this could be, then we go on double guard. Medical prevention in people with high risk can also be done. Of course, that's not something I would recommend, but there can be, people are given estrogen blocking medicines. Now, this is often given in people also who have had um, a treated breast cancer or a treated certain other cancers as well. This is given to cut down the estrogens in the body so that it doesn't provoke cancer again. We'll talk about how we can do this in a better way. And prophylactic mastectomy. I already told you that Anjali Jolie removed both breasts so that she could not get breast cancer. Now, breast cancers, if they are allowed to remain and grow, they can even spread to other parts of the body. Of course, the body tries to localize it in one spot. And while I'm talking about this, I do want to say that right now, all of us have cancer cells in our body. Our normal cells are controlling the cancer cells. So if we can do everything to keep the cancer cells under control at all times, even if we get breast cancer, we should be able to reverse it. If Dr. Lorraine Day could reverse breast cancer that had gone so far that it literally was the size of a grapefruit, then why can't we prevent it and also reverse it if we find it, right? So let's work at that level rather than the other treatment, and I'll soon tell you why. So breast cancers, if left alone and nothing done, can spread. They usually spread to the lungs, to the liver, to the bones, to distant lymph nodes. Let me show you all this. And also, it can spread to the brain. These are the common areas of metastasis. And once we suspect metastasis, we go into more diagnostic tests like PET scans, and also it only increases all the things that we're doing. And we shouldn't ever forget that these kind of radiations actually can be one of the causes of cancer. So conventional treatment usually has surgery, chemotherapy, and radiation. Now, you can cut cancer out, but if you don't remove the causes of cancer, it will come back. You can cut, in fact, any tumor out. Remember that tumors are only our body talking to us and telling us that we need to make some changes quickly. We can take chemotherapy, and the problem with chemotherapy is that it kills all fast growing cells. So it does kill the cancer cells, which are always fast growing cells, but it also can harm other fast growing cells like red blood cells and white blood cells and hair cells and skin cells. And chemotherapy can have problems all over the body. And that's why nobody really wants to go in for chemotherapy, because it already has such a bad reputation. Nowadays, there's targeted therapy. And targeted therapy and even immunotherapy sounds so good because it sounds as if they're just targeting particular cells. And if you do targeted therapy instead of just broad chemotherapy, everything will be fine. Nothing could be further from the truth. Targeted therapy targets changes in the cancer cells that help them grow and divide. So it can also block the growth of or reproduction of certain other cells. And so it can also have a bunch of side effects. And that's why an ounce of prevention is worth so much of cure. Radiotherapy. Radiotherapy is X-rays. X-rays cause cancer. But radiotherapy is localized X-rays to burn the cancer cells in a particular area. And Of course, all these therapies can be good when things are urgent. But otherwise, we could do things differently, and we'll soon talk about that. The side effects of radiotherapy are the side effects of any burn, like skin blisters and dryness and soreness and swelling and pain and hair loss. And of course, systemic changes also like tiredness and fatigue and weakening of the bones long term. And chemotherapy also does that, and damage to the nerves, long term side effects. Now, how can we work differently? Is what we're going to talk about today. So, logical prevention and reversal of cancer. Can anyone tell me what we could do if we wanted to logically prevent and reverse? And you can type into the chat box, or let me stop my share and see if anyone's. What would be the logical prevention? Anybody want to say anything? Okay, so few answers. Stop dairy. Dr. Renu, I really appreciate your work at the level of cause. Okay, diet, change in lifestyle, very important, because when we're diagnosed with cancer, the very first thing we feel is frightened. What's going to happen to me? And because cancer has such a bad reputation, but we have to recognize that our body is telling us something. So, really, it's going to be understand the causes of cancer and remove them. And so now we're going to look at the various causes of cancers in general and breast cancer in particular. So, number one cause of cancer is excess proteins. I know that we've been taught protein is good for you and so on. But remember, today we're having more protein than ever before, just because we have refrigeration, we are raising livestock in ways that, by um, this, confined agriculture of livestock and even fish farms and so on. And then we have all these um, protein powders and things. Now, proteins are the food for growth and repair. We must not forget that cancer is a growth. And so we should minimize, of course, all the animal products because they're high in protein. There are plants that are high in protein too, like beans and greens. But when a food is meant for us by nature, because instinctively we are attracted to plants, then this food also has the substance which prevents us from overeating, which is fiber. If you eat plant foods in the whole form, you're unlikely to overeat. Like if you're eating animal products, it's easy to overeat. Paneer or cheese or eggs or meat, and that's because it has no fiber. If we have dals with the chilka, or even without the chilka because it still has fiber, nobody will tell you that today I overate dal. It's very unlikely because the fiber fills you up so that you can't overeat, right? So at least we can be more conscious because some people they eat just out of habit, but we won't be hungry if we have eaten whole plant-based proteins, but we may still have space in our stomach when we're eating animal proteins because of the lack of fiber. And of course, when we have cancer, often doctors prescribe more protein and they prescribe protein supplements. And these are absolutely harmful because proteins are the food for growth and repair, and cancer is a growth. The second is excess fat. Breast tissue is a place where there's anyway more fat. But if we have excess fat, the fat Here you see a test tube with blood that has been centrifuged, and you see the plasma is clear. But if you see this test tube where someone has eaten fat, the fat goes into the bloodstream, the plasma becomes translucent or viscid and thickened, and the blood becomes thick. And so the heart has to pump harder, the blood vessels get clogged, and the oxygen from the blood doesn't reach every single cell. So as the fat accumulates in our cell, in our arteries over a period of time by eating fatty foods like animal products and oil, ghee, and butter, the arteries become narrower, the blood becomes viscid, and cancer cells can survive with less oxygen than normal cells. So, if you are blocking your arteries over time, you're sending an invitation to the cancer cells that please come because the normal cells can't survive, but you can, right? So we really need to make our body inhospitable to cancer by clearing out these arteries that have accumulated fat over time by increasing our fiber. This chart shows that countries with higher consumption of fat, and it's interesting to see that India is not on this, but countries with higher consumption of fat are more likely to have higher incidence of breast cancer. Now, the fat also can cause heart attacks or angina or high blood pressure, or fat inside the um, muscle cells can also cause diabetes. And it's very interesting to note that many times people who have breast cancer already have high blood pressure or diabetes. And when we take medicines for high blood pressure or diabetes, the body is forced to let us know in a third way or another way that something is wrong. And therefore, breast cancer is produced. So, diabetes and hypertension are comorbidities. And if we want to cure, we have to cure everything at the same time. Foods rich in fats, I already said, are oil, ghee, and butter, and all animal products. Because all animal products, if you boil them, you get fat on top. Boil meat, fish, chicken, or milk, fat on top. It's interesting to note that even plant foods that are rich in fats, like peanuts, coconuts, sesame, or olives, or avocado, though they are rich in fat, and nuts and seeds, though they are rich in fat, they also have fiber. And if you boil any of them, the fiber holds on to the fat, it doesn't come on top. That's what the fiber does in our body as well. Now, dairy, and some of you even mentioned this, is a big cause of breast cancer because dairy contains powerful growth hormones. It's the food to make a baby calf grow to full size in 18 months. It also contains IGF-1, insulin like growth factor 1, which is a known carcinogen. It contains casein, which is a known carcinogen. Casein is the milk protein and obviously also the whey protein. And because whey is made from milk. And hormones in dairy can promote hormone dependent cancers. Breast cancer is often a hormone dependent cancer. That means estrogen. Remember, we said that they give medicines to break down the estrogens, but milk contains estrogens. Milk contains progesterones. And therefore, even before we try to break down the estrogens in the body, and often for breast cancer, even the uterus can be removed, uterus and ovaries can be removed so that your body doesn't produce hormones that promote the cancer. But imagine we're still taking dairy that contains the very same hormones that are promoting the cancer. So we have to remember that our body never does something bad for us. But what we're putting into our body can be harmful. When breast cancer is checked, it can be ER positive, PR positive, or HER2 receptor positive. Now, ER is estrogen receptor positive, PR is progesterone receptor positive, and HER2 is a human, sorry, I'm forgetting the name, but it's another kind of receptor. And if any of these are positive, these are hormones that we are producing or that are coming in from the dairy. So the first thing we should stop is the dairy. Now, if these are positive, at least we can do something, cut down the hormones. Sometimes they can be ER, PR, and HER2 negative, triple negative, or ER negative, or PR negative. So the type of cancer is checked, and the treatment in conventional medicine is given accordingly. Now, lack of fiber, we've been talking about fiber all this time, and fiber is so important. Fiber is only found in plants, and of course, it's removed when we refine the plant. So we want all plant foods to be high in fiber. Whole, no peeling vegetables, not peeling fruits that don't need peeling. Actually, our body is alkaline. And if we create an acid environment, then we are also inviting the cancer. And so we have to stop inviting cancer by reducing the acid in the environment in the body. Now, what is acid? What is the acid brought on by? We'll just talk about that. But the most alkaline foods in the world are fruit, all fruits, even lemons that are seemingly sour and acidic. They are high in potassium, they are alkaline in our body. All fruits and vegetables are alkaline, with fruits more than vegetables alkaline. And the most acidic foods are all animal products, because remember, protein breaks down into amino acid, and plant-based products like sugar, coffee, tea, wine, alcohol, vinegar, salt, colas. You know, if you've looked at packaged food contains acidity regulators, because acidity prevents the bacteria from multiplying. Actually, these acidity regulators are preservatives. Sugar is also a preservative, alcohol is a preservative, salt is a preservative, vinegar is a preservative. So we got to remember that animal products, preservatives, and drugs, tea, coffee, colas, these are, and alcohol, these are drugs, and these need to be avoided. Other cancer causing foods are sugar. Sugar, cancer cells just multiply in sugar. Processed meats, they contain nitrites, and cooked meat. When you cook the meat, it produces heterocyclic amines, which are carcinogenic. And when you cook a carbohydrates at high temperature, you also create acrylamides, and acrylamides are also found in coffee. That's why it's so important to stop tea, coffee, colas, caffeine, and all these foods. And that sounds very daunting, because sometimes when you hear this, you say, well, what am I going to eat? So we'll get there, right? We also have to remember that chemicals are carcinogens. And where are the chemicals coming from in our life? Number one, from the packaged foods. Number two, from the non-organic foods, like the conventionally grown fruits and vegetables, because they're sprayed with pesticides, and pesticides are chemicals, carcinogens, carcinogens. And then personal care products. You know, perfume has the maximum number of chemicals that are carcinogenic. And unfortunately, perfume is added to so many personal care products like soaps and shampoos and deodorants and lotions and potions and hand sanitizers and face washes and whatever cosmetics. We also have to remember that most toothpastes are made with all kinds of chemicals, so we need to minimize these. And we can't forget that medicines are chemicals. Remember that so many people have diabetes and hypertension and other diseases before they get cancer, and they're on medicines for these as well. Double whammy. And then home care products. They are also full of chemicals that are carcinogenic that we're breathing in. All those phenols and window cleaners and toilet cleaners and air fresheners and agarbattis and scented candles and what have you. And other chemicals, like when we, nowadays so many people order food from out. Well, all that packaging is plastic, and plastic is a carcinogen, leaches into the food, especially if the food is hot or the food is acidic. And non-stick cookware contains Teflon, which can be carcinogenic. And of course, there's pollution everywhere. We're using more plastic than ever before. And where I live, for example, they're burning plastic everywhere because they don't have proper garbage disposal, but there is no proper garbage disposal because these plastics never disappear from the face of the earth. It takes years and years and hundreds of years. And therefore, the plastic that we produce daily is going to kill us. And so we should at least minimize our usage of plastic. And then electromagnetic frequencies, like the mobile phones and mobile phone towers and all those remotes in the house, and of course the microwave itself, and the laptops and all of this, TVs, we should minimize their use and at least turn them off at night. Now, some of you spoke about this and loving yourself and stress, and I can't emphasize on this more, especially anger and resentment, stress and grief and anger that has remained in our mind and keeps coming out to, it's eating us up, just like the cancer. So we really need to minimize that stress, and this can be done first by actually understanding the whole situation from everyone else's perspective. I highly recommend family constellation for this, but there are other ways as well, like counseling. And Jaishri, our counselor, she, as Sharan's counselor, she had cancer, I think 14, 15, or maybe even longer years ago. It was treated conventionally and she got a recurrence in just 9 months. It was an ovarian cancer. And she, being a counselor herself, started looking inwardly. She was given a book by Louise Hay. She studied it. She started thinking about what she needed to change. And one of the biggest things that we need to do is forgive everyone. Sorry, forgive everyone. Because it's that anger and resentment that is working into cancer. Now, forgiveness sometimes looks very hard, but forgiveness is something that we have to do, not for the other person. We have to do it for ourselves to free ourselves of the anger that's eating us up. And then lack of sleep. I can't emphasize this more because sleep is so important. It's the only time when our body can heal. Now, exercise is also important, but sleep is very important while healing. Now, is a cancer curable? It depends on the age. The younger you are, the more easily curable it is. The type of cancer, the duration of the cancer before we start working on it. But remember that Dr. Lorraine Day reversed her cancer when it was at a later stage. The treatment given, because sometimes the treatment itself can kill. The causation, the compliance, like how much are you willing to do? Because I know that many people are not willing to make the changes when they get cancer, or they don't know how to, or there's nobody to help them do it. So the compliance, the life situation, like what if you're living all alone? What if you have to be in the hospital? And most importantly, the will to get well. If your decision is no matter what, I'm willing to do everything to get well, you will. Why should I change my lifestyle now? We should change our lifestyle before we ever get cancer so that we never get cancer as far as possible. I just want to say a little bit more about cancer. Breast cancer is the leading cancer worldwide, and it's largely preventable by eating plants, only plants, by making sure that we eat only whole foods, that we eat only organic, no chemicals, and high raw. If someone already has cancer, I would recommend 100% raw, and if that's not possible, as high raw as possible. The only reason it may not be possible is because it's too hard to change everything overnight. I know a lot of people who get cancer who have never eaten raw in their lives. So, how can we eat more raw? Because we need high quality spare parts to heal. Remember, these foods are your chemotherapy, your radiotherapy, your every therapy. And so, if we can eat all the colors of the rainbow every day, we will heal. Now, tell me, doesn't this food look appetizing? We are always attracted instinctively to colors. And if you can't consume these foods as salads initially, or even because of the treatment that you're undergoing, chemotherapy or whatever, it is worth having vegetable juices because that's like flooding the body with high quality nutrients in a way that's easily digestible. And so, even though I recommend whole foods always, for cancer cases, I recommend vegetable juices because for too long they have not been having high quality nutrients. And now we have to work really fast so we can have a mix of whole vegetable, whole plant based foods and vegetable juices, no fruit juices. Remember, sugar is a cause of cancer. And then check and supplement vitamins B12 and D. So Sharan has a 5-point plan. Everything should be plant-based, everything should be whole, everything should be organic, everything should, I mean, vitamin B12 and D should be checked and supplemented. How to check and supplement is on our FAQ section on our website. Now, imagine sometimes we eat like this, and even we know that eating like this is much healthier. Honestly, eating this way is more fun than chemotherapy or anything else. So, if we can start doing this, at least make sure that one fourth of your diet is raw every day, and make sure that if you have cancer, you're as high raw as you possibly can be. And even people who are undergoing chemotherapy and radiotherapy have less side effects of these when they are on a high raw diet. Now, I just want to leave you with some references to learn more. I told you about Dr. Lorraine Day. She's written books and she has videos, and she has a 10-point plan which has an acronym New Start AB. News N stands for nutrition, E for exercise, W for water, high quality water should be consumed, S for sunshine, we should always spend time in the sun. T for temperance, which means no bad habits, alcohol, smoking, um, tea, coffee, colas out of the window, and any other drugs. Air, fresh air. It's important to get high quality fresh air. Rest at the right time. Trust in God. Trust that nature will provide us with everything if we are willing to listen and listen to our body. An attitude of gratitude and benevolence. What a beautiful 10-point plan to reverse cancer. And I have to say that Dr. Lorraine Day did not get cancer at a young age. She got it at a later age and she cured herself. This is Chris Walk. He's written a beautiful book called Chris Beat Cancer. Anyone who wants to know about cancer should read this book or even subscribe to his newsletters, because once in a while he gives out for free his online program, Square One, which is just fantastic and should not be missed and can be even bought. Then Louise Hay. She was a queen of changing your mind to heal your body. And she's written a book, You Can Heal Your Life by Changing the Way You Think. So very important. Chris Carr got a very severe fourth grade cancer at a young age. And youngsters like her, it was so difficult to change because it was difficult to go from fast food, unhealthy lifestyle to a totally healthy one. And she talks about her story. And I really like this book. Cancer is not a disease, it's a survival mechanism. It is the way our body tries to isolate unhealthy cells so that they don't spread. And if we don't assist in the spreading of cancer, we may be able to localize cancer for a longer time. So, steps for prevention and reversal. And I am seeing that people are asking questions, and I will answer them very soon. Remove the fear, first of all, by looking at the stories of these various people who have reversed their cancer. Sharan's 5-point plan for nutrition. Dr. Lorraine Day's 10-point plan. Remember, Dr. Lorraine Day had breast cancer. Minimize chemicals. Work on stress and on your emotions. And remember, the disease is a path to personal growth. All this work is personal growth work, which is what we're here for on this planet. We have to work on ourselves at every moment of our lives. Now, there are a few final thoughts that I want to share about cancer before I invite Manish Sangai. Manish Sangai is a health coach, and Manish Sangai helped, healed himself through Sharan's lifestyle. He'll tell you about it. But more importantly, he healed his mother's very severe cancer, breast cancer, triple negative breast cancer with Sharan lifestyle. So before we get there, a few final thoughts. Uh, Definition of cancer, it's an unregulated overgrowth of undifferentiated cells, ultimately harming and destroying the very organism on which it grows. And we are living in the age of cancer because we are creating cancer on our planet. If you consider our planet as a living organism, then we are creating the cancer by, you know, monocropping, by use of and pollution of plastic, by animal agriculture, factory farming, and we have to recognize that today the way we eat, the biomass of all the animals, all the living things on the planet, humans occupy a large amount, but livestock even larger. So that all the other biodiversity almost doesn't exist and is going into extinction. We are a cancer on our planet and we have to stop being that cancer. And so reversing disease requires a shift in consciousness from a culture of disease that we're living in now to a culture of health. Now, how can Sharan help you? We have fabulous events on our website, and the one I most recommend is Jayshree's free event happening every Wednesday, where she offers answers to people who have cancer. Please don't miss that. Consultations. We are doing consultations for cancer every single day. Cooking classes. And I don't want to miss the recipes on our website. We have a special section on salads and we have a special section on raw recipes. And our retreats. And the way the retreats help is that they help you get on the path immediately, because while you're there, you're on the path, and it sort of helps you build those habits so that you can stay on the path, and also so that you can understand that this is enjoyable, because people think that Sharan lifestyle could be a deprivation. It's not. And of course, we have this recipe book in 3 languages, and our recipe or our whole website can be translated into almost any language. There's a translate button. Now, I want to stop my share and invite Manish to share his story, mother's story. And Manish is a health coach, as I mentioned. He was a yoga coach and a yoga enthusiast, and then he came to Sharan, and now he's a total health coach. Manish, would you like to share your story?
Yes, ma'am. Thank you very much. So thank you, ma'am, for all the self-life efforts you have been taking. I've been seeing you over the past 2 years. So quickly coming to my mom's story first. So my mother was diagnosed with stage 3 breast cancer, and this was in March 2022. So she had some lump in her breast, and we did her all the PET scan and all. And doctor told that she has a lump in her breast, which has metastasized, and it is like spreading to the axilla also. So we need to do a surgery as soon as possible. We got the surgery done, and it came out to be stage 3 breast cancer, and it was triple negative, like ma'am said. And we were told that it's a very aggressive form of cancer. But apart from cancer, she also had liver cirrhosis. This was there since 2012, because of which her platelet counts were very low. So doctors told that since this is triple negative, we cannot give hormonal therapy. At the same time, because the platelets are so low, chemotherapy cannot be given. So she just took very low dose radiation therapy just for namesake, and the cancer relapsed in October of 2022, just within 6 months. So we had the second surgery done in October 2022, and again it came out triple negative, very aggressive. And doctors told that since it has relapsed so fast, so chances of survival are very less, maybe a few days, a few weeks, or few months. We cannot say. In between March and October, I went through severe depression myself. I had certain other mental health issues, because of which I connected with Sharan. I attended their 7-day retreat in Pune, wherein Captain Joseph Pinto and his wife, Rose Pinto, they helped me overcome my mental health challenges, and I reversed many other conditions, which I'll share later on if I get time. But more importantly, they introduced me to the diet, what Dr. Shah spoke about today. Initially, I was a bit skeptical that they are just doing their marketing and all, but I followed it myself to the T, and I benefited a lot in the next 3, 4 months. And when my mother got it, I contacted them again, and they sent me to Jayashri Kannan, the Sharan facilitator ma'am spoke about in her talk. And she like convinced her with her own story, her own cancer reversal story, to follow this, because we had no other solution. Doctors told that we can't do anything, and we just had this. And me being a health coach myself, I also started working on a mindset. We changed the diet completely, so all the dairy was out, all the processed stuff, all the stuff from outside. We stopped eating outside food completely as a family just because of her, and the entire family's health improved. That was like a byproduct of following a good lifestyle. And doctors told that it may come back anytime soon. So in October of 2023, she again got a lump in the same area in the left breast. Thankfully, it was not cancer, and it's been 2 years now. I got her tested just 3 days ago. Her ultra USG was done, and still no trace of any lump. So this is just, I would say, we just followed nature's law of putting in the right things in the body, and we just followed, just trusted, had faith in the Sharan lifestyle, and that did wonders for her, apart from her cancer. So because of liver cirrhosis, she had some varices in her esophagus, because of which there was bleeding initially. We got her this endoscopy done last month, and the doctor which did endoscopy is my friend. He's a gastroenterologist, and he called me inside the procedure room, and he told me, Mani, just look at this. I thought that there is something wrong, but he was like literally tears in his eyes. He told that, Manish, it is healed completely, the varices that were there. And he told me there is no banding required now. Earlier, he used to band it always so that it doesn't rupture and doesn't bleed. So her liver enzymes are under control. Platelets are gradually increasing. It is not still recovered completely. And she has become, anyone who meets her, it's like she's growing younger by the year. Matlab the look she had 2 years ago, her wrinkles has gone away, and she is like active, able to walk. Her vertigo issue also solved. I didn't share this with Dr. Shah. She had huge vertigo earlier on, that also is gone. So I would say, I just hope that I just keep like Nisha Koiri at the start. She just keeps mailing on Dr. Shah year after year. So I just hope that year after year, I just keep coming here with this story that yeah, the cancer is still dormant, and I just hope so, because I know that nature, like we know that Hippocrates, the father of modern medicine, he also said that food is the real medicine. So we just put real medicine into her body to stop putting all junk. And this is how she responded. So I would say we didn't do anything magical. We just followed what Jayashri Khan and Dr. Shah said, and it worked wonders for her. Thank you, Dr. Shah.
Manish, it would be good to share your story in short also.
Sure, I'll do that. I'm actually 41 years old. I don't look like 41. That also because of the diet that I'm following. At the age of 19, I got ankylosing spondylitis. At the age of 24, I got Crohn's disease. I had zero sperm count. I had hemolytic anemia. So basically, my immune system hated me. I had 4 autoimmune conditions at the age of 24, and doctors told me that Manish, you will need a hip replacement surgery by the age of 30. I was like terrified, and I wanted to end my life. I was just married and all these conditions. So I just worked on my diet and lifestyle. Initially, it was not Sharan. It was actually the Yoga Institute Santa Cruz that helped me, but similar lines. They worked on my mindset. They make me understand that most diseases are psychosomatic in nature. There is a stress element in every disease. So they worked a lot on my mindset. With my mother also, we worked a lot on a thinking, on a thought patterns, a lot of affirmations, a lot of visualization. I did that with myself also. And doctors told me that I have to be on medications for the rest of my life. It's been 17 years now. I haven't taken a single medication except for certain supplements, D3 and B12 supplements. I haven't taken a single medicine. And doctors told that Manish, at the age of 32, you will need a hip replacement. At the age of 32 only, I ran a half marathon. So, and one doctor told me that I cannot father a child. I'm a proud father of three children now. So I believe every disease has a solution. Everything can be reversed. It's our belief, it's our desire, it's our like desire to get well. So I really wanted to get out of the disease that I was going through. I stopped blaming the God. I stopped blaming the situations. I took my responsibility and I just kept working on myself without thinking too much about the future. Just started working on myself day after day. I did a lot of courses from the US also about health coaching, like ma'am said, because I really wanted to go into the science of holistic health, holistic healing. And there is so much of data. People at Cornell University, people in New York at IIN, they also talk a lot about plant-based diet. In fact, every teacher I have learned under, they speak about plant-based diet. At least 80 to 100% they say should be plant-based. And people in the US are like shifting to what we were following earlier, and we are like following Western diet. So that's a different story. But yes, I did a lot of like self effort, a lot of self work was there. God's grace, I kept meeting people like Dr. Shah, Captain Joseph Pinto, Rose Pinto,
I
and
just want to
Jayashri
say that
Tandon.
Manish has, so many conditions, including ankylosing spondylitis. Very hard to reverse. He has looked after and handled.
And then
And
Crohn's also. That was even
Crohn's,
severe. That
Crohn's
was even
disease,
severe. That was even severe.
ankylosing spondylitis, azoospermia, that means no sperm, like not able to conceive, and all gone. So congratulations, Manish, for all of that. And Manish last year also did our facilitator training program, and now he's teaching courses. And really, congratulations and hats off to you, and may you help many, many, many people. So there's one question that came to you, Manish, that I'm just going to read to you. How did her lump that came in the third time go away? Was it through surgery or it dissolved through right food?
No, it was surgery. The third time also it was surgery, but it was benign. It was not malignant the third time around.
Oh, okay, thank you for that. Huh? So remember that his mother, it's 2 years now. Dr. Lorraine Day, so many, many years. And Nisha Koiri, also many years. So everyone is going to get well if they put their mind to it. Thank you, Manish.
I just want to end with it is health that is our real wealth and not pieces of silver and gold. And from all of us at Team Sharan, wishing you and your loved ones good health always. Thank you so much. Thank you.
Thank you. Thank you, Reena. Bye, everyone. Thank you.